Hi, my name is Jae Neal and I'm a pharmacist. I have fallen in love with a medical method called a functional diagnostic medicine approach. Today I'm going to bring to you an actual case study. I'm going to call her name Lisa. She has a different name, but this is to protect her privacy. She is a patient of Dr. Grisanti, who heads Functional Medicine University, and I am a student there right now. Lisa came in to see Dr. Grisanti. She has psoriasis spreading over for 5 years. It started on her upper arm, and then it spread to her back. And then it started spreading down her arms and into her joints, and then into her nails. Now, let's talk a little bit about psoriasis. So what is psoriasis? It is a buildup of skin cells that's growing almost too rapidly, and it has nowhere to go, so it just develops like a scab on the skin. The Mayo Clinic, which is a very famous clinic that we all know about it, says the main goal is to stop having these cells grow so quickly. There is no cure, but we need to learn to manage with medications for the symptoms. So what are some of the symptoms? You can see red patch on your skin, scaly, dry, cracked, itching, burning, swollen, stiff joints, and list goes on. And so you could imagine if you have this kind of scaly skin growing on you and it is so uncomfortable, and not only that, it's visible, it's a pretty miserable thing. And so Dr. Grisanti looked at her treatment history. She went through four medical doctors, out of whom 3 were specialists. So when she went to see her primary physician and he couldn't resolve her situation, he sent her to a dermatologist. And one dermatologist, with everything he knew, was not resolving the situation. It was still growing. So either he sent her on to second dermatologist, or she just sought for somebody else who might do a better job. So she saw 2 dermatologists, and then when these 2 dermatologists could not resolve her problem, and it still kept on spreading through her back and through her arm, she went to see allergist. So, and then she also had pretty intensive medical treatment. She probably started out with creams and ointments, and these are very common creams and ointments. I fill them every day on throughout the years, and there you might recognize it also: clobetasol, triamcinolone, fluocinolone, and betamethasone. And what it is it's a corticosteroid, and the recommendation on those medications is not for widespread area, and also not for a long period of time. And so in her situation, it's growing, it's covering a lot of areas throughout her body, and also she's had it for 5 years. And one of the side effects could be, it could increase the risk of infection if you are using it the way you're not supposed to use it. It could thin the bones, and fractures can happen easily, and also decrease in adrenal gland hormone production. And it's easier to, because skin becomes thinner, it's easier to bruise and slower the wound healing. So then a doctor probably prescribed retinoids. And retinoids are very often used for stubborn or severe psoriasis. And again, the patient may experience side effects that you don't want, and especially if you're a woman and you have potential to be pregnant, you never want to be on retinoids during that time. And then the most powerful drug of all of these three categories would be methotrexate. And that I first learned about this drug as a cancer drug. It's used for cancer of breast, skin, head and neck, and then it's used for severe psoriasis, which they used it in her case, and also it's used for rheumatoid arthritis. And retinoids can have very serious life-threatening side effects to your liver, lungs, and kidney. And what it does is it stops the rapid duplication of fast-growing cells. Usually cancer cells are growing very fast. So this could stop the rapidly producing cells, which is happening in her psoriasis. It's not cancer, but it's rapid growing cell. So anyhow, with this intensive medical treatment, it was still spreading, and she was still having pretty miserable time. So Dr. Grisanti, she reviewed the past medical history, which was all the records from these 4 doctors. And also Lisa had to fill out 41-page questionnaire. And that is pretty extensive. And he studied both of them completely before she ever came in for her first appointment. And I'm going to talk about, and after reviewing everything, he ordered these 5 tests. He probably ordered it at different times during the treatment, but I will explain a little bit about what each one does. And each one, when I studied, I would have to study several hours or even weeks to really fully understand how each one of them really work and what it represents. But I will only spend maybe 2 minutes on each one. Okay, CBC differential. Okay, it shows the status of your red blood cells and their components, white blood cells and their components, platelet levels, hemoglobin, and hematocrit. And often this is done to diagnose or screen for certain diseases like anemia, infection, leukemia, etc. And then comprehensive digestive stool analysis. This shows parasitic and bacterial involvement that can interfere with normal GI function. Also, it can provide information about digestion, absorption, bacterial balance, yeast overgrowth, inflammation, metabolic activity, and immune function. So that's pretty comprehensive. And this is stool analysis, which means in your bowels. The third is intestinal permeability. So we need to know if our intestines are releasing things it should not release. Intestines should be our gut, intestinal or our gut should have a tight control on what ingredients should be released to your blood system. The only thing that needs to be released is your nutrition that has been processed and that can be utilized utilized by your body for food and nourishment. Anything else can be very dangerous. The fourth test is Candida immunoglobulins, and that's to see how much Candida, or if a person has Candida infections. And Candida is worldwide #1 yeast or fungal infection that human beings get. And then intestinal barrier function test. And what that is, this test provides excellent tool for detection of the most common causes of altered intestinal permeability and poor assimilation of essential nutrients. Now let's see what Dr. Grisanti found about Lisa from these 5 tests. When he looked at CBC differential, he noticed that there was increase in monocytes and increase in eosinophils. Those are 2 of the several probably 2 of the 5 white blood cells that's in your body. So these 2 are increased here. And when he looked at the previous history from the 4 doctors, it could be from 1 doctor or it could be more than 1 doctor, their CBC differential also showed there was increase in monocyte and increase in eosinophils. The first thing he realized was, aha, she has either parasitic or fungal infections. For some reason, all 4 doctors missed it when they got the exact same. They were taken at different times, but it showed that during 5 years, there's increase in these 2 specific white blood cells. Now he got one key clue. So either it was parasite or fungal infection she was suffering from. Then when he did comprehensive digestive tool analysis, he found out she had higher population of candida, which is yeast/fungus. In her stool analysis, that means in her bowels, in her colon, she had higher candida. So now these 2 already match. Now he's getting a little bit more clear what he's looking for. Then in intestinal permeability test, he found out that she has intestinal permeability, which means her gut lining was releasing things beyond food and processed food, I shouldn't say processed, beyond digested food for cell nutrition and vitamins and such. Beyond that, it could include toxins, it could include portions of bacteria, it could include undigested food. And when all these get into your blood system, it becomes an illness for the host. Okay, and then on Candida immunoglobulins, he had this test done because he already saw from their history that she had some fungal or parasitic infection. And on he also saw that she had fungal or parasitic infection. So by now he got confirmation that she has Candida infection. And then the next test is the last test, intestinal barrier function test. This is where he found out that Candida, the yeast or fungus, had escaped into her blood system. And she's been suffering for it for all this long. And at the same time, what he saw here was, okay, so up to this point, now she's got systemic Candida. One item resolved, that one of the root cause. The second thing was shown by intestinal barrier function test is she had extremely low immunoglobulin A. Now, what is immunoglobulin A? When you and I get infection, if it's acute infection, your body just bombards that infection virus or bacteria with immunoglobulin A. This is our first response that usually happens in our gut system because that's where a lot of times infections come through. And then what it does is it immediately takes care of the virus or bacteria, and then other arsenals come in and it cleans it out. Okay, but in a situation of, let's say she had intestinal permeability for last 5-6 years or whatever, or probably a lot longer than that, as this immunoglobulin A is attacking these organisms, that there are more organisms that are being duplicated, and ultimately, if she is suffering infection for over many years, your body is not able to produce that kind of high response for the whole number of years. We have only limited resources, and eventually the number of immunoglobulin A gets lower and lower and lower. And when he saw that, he realized that she's been suffering from the systemic candida for a long time, probably 5 years. And so now, what he needs to do is he addressed these two things. So he doesn't have to worry about anything else. He addressed these two things. And by addressing those two things, the result is he was able to free her of psoriasis in 5 weeks. He did not have to use these powerful drugs that comes with so much dangerous side effects. I mean, something like methotrexate is an incredibly strong drug, as well as retinoids. And even these ointments, if you use it for a short period of time, it's okay, but not for an extended amount of time. So the result is pretty profound. Now, how did he take care of it? This, he didn't say, but I'm going to put in based on how much I learned so far in this functional medicine. Okay, Dr. Brisanti is chiropractor. There are several medicines that could take care of yeast infection, but he cannot write a prescription. So what he could do is he could call the primary physician and have him prescribe fluconazole, itraconazole, or nystatin. And that would take care of candida. And when a medical doctor sees all the tests that shows that she has systemic candida infection, he would gladly write prescriptions. So, or that's one of the ways he could do that. Or he has whole arsenal of botanical antibiotics, which does not need prescription because it tends to be much safer and without much side effects. Okay, some of them are, these are from my studying, and it's not his. So he could have used any of these, or he could have had whole bunch more botanical antibiotics that I am not aware of at this point. Garlic has incredible ingredients in it. I don't have specific name of the ingredient, but there's some other items, undecyclinic acid, plant tannins, uva ursi. All of these are very powerful botanical antibiotics, but you have to reach a certain level of like Dr. Brisanti would know how much to take for how long and the dosage and etc. This is not something you or I, before having the knowledge, just go buy some just to treat yourself. Okay, and then how do you take care of extremely low IgA? That can be done with L-glutamine. This is a very common product that anybody can buy. It's a natural therapeutic agent, well documented to normalize immunoglobulin A. And also, Saccharomyces boulardii is a probiotic which can normalize extremely low IgA. And then, so he takes care of these two, and once as these items are being taken care of, then he would come in and to strengthen the gut biota. And the result was free of psoriasis in 5 weeks. You could imagine a happy, happy patient who suffered this for 5 years, having resolved without any detriment of strong side effects and such. And that is a functional diagnostic medicine approach. And thank you for watching, and I'll be back in about a month.